A 40 years old lady present with gastric carcinoma or greater curvature of the stomach. Her staging investigation are negative for metastatic disease. What is the most appropriate treatment option? So there is a carcinoma in the greater curvature of the stomach, but there is no lymph node metastasis. So what may be the treatment option? Here the options are the radical radiotherapy, subtotal gastrectomy due to lymphadenectomy and Rho and Y reconstruction, subtotal gastrectomy due to lymphadenectomy and anterior gastrojejunostomy, esophagogastrojejunostomy, and sleeve gastrectomy. Now see the treatment option of the gastric carcinoma. Proximally seated disease greater than 5 to 10 centimeter from the OG junction. That means the esophagogastric junction, it is 5 to 10, then be treated with subtotal gastrectomy. Total gastrectomy if done when the tumor is less than 5 centimeter of the gastroesophageal junction. That means when there is the cancer in the upper part of the stomach which is within the 5 centimeter of static of stomach, then in this condition total gastrectomy. But when it is situated below the level of 5 centimeter, then in this condition subtotal gastrectomy. So for type 2 junctional tumors extending into the esophagus, and esophageal gastrectomy is usual. Endoscopic submucosal resection may play a role in early cancer and which is confined only the mucosa and some portion of the submucosa. So when the tumor is confined only the mucosa or submucosa, in this condition there is possibilities to give the treatment of endoscopic submucosal resection. Then lymphadenectomy, in both cases they should be done, and a D2 lymphadenectomy is widely advocated by the Japanese, but the survival advantage is debatable. But most patients will require the chemotherapy after the operation. Here we can see the Rho and Y construction, in which what actually done, the part of the stomach is removed. Then what we do, the jejunum, cut the jejunum and take the jejunum to this stomach, and the duodenal stump, one side closed and another side it is anastomosis with the jejunum. So what actual process? The actual process is the gastrojejunal anastomosis, jejunal anastomosis with closure of the duodenal stump. So what is our treatment option? Our treatment option is the subtotal gastrectomy, D2 lymphadenectomy, and Rho and Y reconstruction. So it is a treatment option due to the carcinoma of the greater curvature of the stomach and the negative for the metastatic disease.